A method I have been using to remember the liver pathologies is by creating analogies. So I usually look at the word and I try to make connections with certain letters of that word. So for these examples, I'm using infectious diseases of the liver. Let's look at hepatic candidiasis. The D's in candidiasis, they look like mushrooms to me. All you need is the stem. So I know that this is a fungal infection that invades the bloodstream. The CA in candidiasis, CA is an abbreviation for cancer, and those who have cancer usually are doing chemotherapy, so they are immunocompromised. So I know that this disease is more prone for people who are immunocompromised. Sonographically, I know that this is going to have a bullseye appearance because if I was to look at a mushroom from the bottom up, it's going to have that bullseye appearance, that echogenic center with the hypoechoic rim. Or most commonly, this mass is seen as just hypoechoic. Now let's look at chronic granulomatous. The G in granulomatous to me looks like a phagocyte, so I know that this disease has to do with phagocytes, specifically them not being able to kill bacteria or fungi. The word matus to me sounds like Mater from the movie Cars, and stereotypically boys like Mater, boys like trucks, so I know that this disease is more prone in boys. And we know kids are always getting respiratory infections, so that may also be a sign for this disease. Next, we'll look at amoebic abscess. When I look at the word amoebic, I think of the amoeba sisters. Amoeba are squiggly. What else is squiggly? The colon is squiggly and lumpy and bumpy, so I know that this disease is primarily happens in the colon, and the only way this parasite is going to infect the liver is from the portal vein. Sonographically, this is going to have lag-defined wall echoes, so you can associate amoeba, the squiggliness, with that. Clinical symptoms would be abdominal pain and diarrhea, and that makes sense because this is a disease that's originating from the colon.